Alzheimer's disease is a progressive neurologic disorder that causes the brain to shrink and brain cells to die. Alzheimer's disease is the most common cause of dementia, a continuous decline in thinking, behavioral, and social skills that affects a person's ability to function independently. The early signs of the disease include forgetting recent events or conversations. The causes aren't fully understood. Genetic, lifestyle, environmental factors, and series of toxic events affect the brain over time. The main focus is on the role of two proteins. Beta amyloid is a fragment of a larger protein, appears to have a toxic effect on neurons and cell-to-cell communication. Tau proteins play a role in a neuron's internal support and transport system to carry nutrients and essential materials. The CNS equals the brain plus the spinal cord. What are the drugs affecting the CNS? Number 1. CNS stimulants and CNS depressants. Number 2. Mostly categorized as narcotics and dispensed with prescription. Most of them are drugs of abuse. Number 3. Unionizable weak acids or weak bases. Number 4. Low molecular volume in order to penetrate through densely packed cells of the CNS. Number 5. Relatively lipophilic drugs. And number 6. Low protein binding. These are the properties of drugs acting on the CNS. Damage of the CNS endothelial cells by toxins and CNS infections may alter the CNS permeability and selectivity, which allows passage of foreign substance and drugs. For instance, sulfonamides cannot cross the blood-brain barrier under normal conditions due to their high polarity. They are hydrophilic, but during encephalitis bacterial infection, there is sort of damage of the CNS endothelial cells, so drugs like sulfonamides can penetrate. For your information, some hydrophilic drugs similar to amino acids can cross blood-brain barrier through amino acid transporters. The functions in the CNS are mostly controlled by more than one neurotransmitter. Neurotransmitters in the CNS may be excitatory, stimulate the CNS, or inhibitory, depress the CNS. Our major neurotransmitter in this topic is the acetylcholine. Loss of cholinergic neurons, low acetylcholine activity may cause Alzheimer's disease. Treated by parasympathomimetics, reversible acetylcholine esterase inhibitors that inhibit the breakdown of acetylcholine into acetic acid and choline. Memantine, N-methyl D-aspartate antagonist, is neuroprotective and approved for treatment of Alzheimer's disease. Activation of NMDA receptors increase calcium, enhancing of the reactive oxygen species, leading to neural toxicity and death of cells. So NMDA antagonism leads to neuroprotection. For your information, memantine is highly basic. The NH2 is protonated at physiological pH. However, they can cross the blood-brain barrier due to cage-like structure made up of 4 rings, which encloses protonated nitrogen, increasing the lipophilicity and decreasing the metabolism, leading to longer T-half. Ginkgo biloba can slow and prevent age-related memory problems. Arcalion forte. It contains salbutamine, similar to vitamin B1. It increases thiamine levels in the brain and improves memory. Somazine contains citicoline, a naturally occurring endogenous nucleoside. It activates the biosynthesis of structural phospholipids in the neural membrane and increases cerebral metabolism and the level of neurotransmitters. It has a neuroprotective effect in situations of hypoxia and ischemia, as well as improves learning and memory performance in animal models. And finally, it restores the activity of mitochondrial ATPase and membrane sodium-potassium ATPase. There are other techniques and ideas to treat Alzheimer. Augment cyclic nucleotide, cyclic AMP and cyclic GMP by using phosphodiesterase inhibitors, promoting blood vessels dilation and blood flow in the brain. Consider Alzheimer's disease as type 3 diabetes and use nasal spray insulin to enhance utilization of cells by sugar for better cognitive functions. Augment expel of deposits from the cells of the CNS by stimulating P-glycoprotein inhibitors which expel foreign substances outside cells. And finally, by acetylcholine esterase inhibitors to increase the level of acetylcholine responsible for memory and learning.